Welcome to our NCLEX Practice Test. This test has 75 questions on topics you'll see in the real exam. These questions will help you better understand the concepts that will be tested on the exam. Let's get started. 1. One of the three smallest bones in the body is the A. Vomer. B. Distal phalange of the small toe. C. Stapes. D. Coccyx. Correct answer, C. Stapes. The three smallest bones in the body are located in the inner ear and include the malleus, incus, and stapes. 2. Which of the following organs would be described as being located retroperitoneally? A. Kidneys. B. Thymus. C. Small intestines. D. Spleen. Correct answer, A. Kidneys. The term retroperitoneal means to be placed behind the peritoneum. The kidneys are located in this area. 3. A nurse is caring for a client who is in labor. The nurse has attached an electronic fetal monitor to the client's abdomen and is assessing the baby's heart rate. She notes that the baby's heart rate seems to slow down during each contraction. The heart rate does not return to normal limits until after the contraction is complete. Which type of fetal heart rate change does this pattern describe? A. Variable decelerations. B. Late decelerations. C. Early decelerations. D. Accelerations. Correct answer, B. Late decelerations. Late decelerations occur when a baby's heart rate declines in utero during each contraction. The heart rate drops below baseline and remains there until after the contraction is complete. Late decelerations are a non-reassuring sign and should be reported to a physician. 4. Which of the following reasons indicates a need for a non-stress test in a pregnant client? A. The client is overdue. B. The baby has not been moving. C. The mother is carrying twins. D. All of the above. E. Both A and C only. Correct answer, D. All of the above. A non-stress test is performed to assess the baby's heart rate and activity during pregnancy without adding any stress to the fetus. A non-stress test may be performed on a woman who has not felt movement from her baby recently, a woman who is overdue, or a woman who is considered to have a higher risk pregnancy, such as someone carrying twins. 5. The key to the prevention of a pandemic influenza is A. Early detection. B. Early antibiotic treatment. C. Vaccination of at-risk populations. D. Isolation of suspected cases. Correct answer, F. Early detection. Early detection of influenza is the key to prevention of a pandemic. The most important warning signal is when clusters of patients with clinical symptoms of influenza are detected. 6. Which risk factor places patients and residents at the greatest risk for falls? A. Old age. B. Middle years. C. Pneumonia. D. COPD. Correct answer, A. Old age. The elderly are at great risk for falls. Those in middle years are less at risk than the elderly population. COPD and pneumonia are not risk factors associated with falls. 7. A nurse is working at the community clinic and is completing a risk behavior assessment on a 16-year-old sexually active female who is coming to the clinic for birth control. The nurse should recommend the client undergoes which of the following? A. Pregnancy test. B. HIV testing. C. Pap smear. D. All of the above. Correct answer, D. All of the above. The nurse should suggest the female client undergoes a pregnancy test prior to beginning birth control. Also, the nurse should suggest the client undergoes a Pap smear, HIV testing, and other sexually transmitted infections, STIs, STI testing if she is sexually active. The nurse should also take the time to educate the client on safe sex and prevention of STIs. 8. You are taking care of Mary Eden. She is an elderly and frail 91-year-old resident. She gets confused during evening hours, and at times she thinks that she hears her daughter calling her from the other side of the nursing home. Which physical problem places Mary Eden at risk for falls? A. Her confusion. B. Her daughter. C. Evening hours. D. Her frailness. Correct answer, D. Her frailness. Mary Eden has frail and weak muscles. This places her at risk for falls. Her confusion places her at risk as well. However, this is an emotional or thinking problem, not a physical problem. 9. What kind of preventive measures is most likely to be used to prevent Mary Eden from falling because of her muscular frailness? A. Physical therapy for muscle strengthening exercises. B. Physical therapy for range of motion exercises. C. Occupational therapy to help her with confusion. D. Medications in order to have her sleep more. Correct answer, physical therapy for muscle strengthening exercises. Mary Eden will most likely benefit from physical therapy muscle strengthening exercises because of her muscular frailness. Range of motion may also be used, but muscle strengthening exercises will be the most beneficial. Occupational therapists do not treat confusion, and sleeping medications add to falls risk, they do not prevent falls. 10. Elderly patients are more prone to dehydration than younger people because the elderly underscore. A. Drink more coffee and tea. B. Have more stomach mucus production. C. Have more saliva. D. Have less sense of thirst. Correct answer, D. Have less sense of thirst. Elderly patients are prone to dehydration because the elderly have a lower and diminished sense of thirst. They do not get thirsty in the same way as younger people do. The elderly also have less stomach mucus production and less saliva, but these changes do not impact on thirst or dehydration. 11. The B in the SBR acronym stands for F. Background. B. Basic. C. Beginning. D. Break. Correct answer, F. Background. The B in the SBR acronym stands for background. The SBAR is a communication tool used between providers that regulates the type and amount of information given. When contacting a physician, the nurse provides information about the situation, the client's background, the nurse's assessment, and further recommendations. 12. A case manager is planning a discharge for a patient who will be placed on long-term antibiotics secondary to a left hip replacement that has become septic. To facilitate a safe discharge, prioritize the following 4 at risk. Problems for the discharge plan: infection, self-care deficit, impaired skin integrity, fluid volume deficit. A. 1, 3, 4, 2. B. 3, 1, 4, 2. C. 1, 4, 3, 2. D. 3, 1, 2, 4. Correct answer, C. 1, 4, 3, 2. The priority for the case manager is preventing readmission secondary to infection. The next priority for this patient is prevention of fluid volume deficit related to complications of long-term antibiotic use. Impaired skin integrity would be the third priority due to the left hip incision, followed by self-care deficit. 13. Decide which of the following tasks may be delegated to unlicensed assistive personnel. A. Cleansing a wound with peroxide. B. Irrigating a colostomy. C. Assisting with performing incentive spirometry. D. Removing a saline lock 4. Correct answer, C. Assisting with performing incentive spirometry. The nurse may delegate certain tasks to unlicensed assistive personnel as part of working together and reducing heavy workloads. Assistive personnel may perform tasks that involve activities of daily living, non-invasive skin care, or assessment of vital signs, including assisting the client with incentive spirometry. Despite appropriate delegation, the nurse is ultimately responsible for the actions of the unlicensed assistive personnel. 14. According to HIPAA, which of the following is considered an individual right for privacy of a client's protected health information? A. The right to receive medical bills for care received. B. A copy of the organization's privacy practices. C. The right to change personal health information. D. An understanding that protected health information will only be used in regards to client treatments. Correct answer: B. A copy of the organization's privacy practices. According to HIPAA, individuals receiving care at healthcare facilities have rights surrounding their protected health information. This information may be used for treatments or billing purposes, and clients may receive copies of how the information was used. All organizations must provide clients with copies of current privacy practices. 15. Which of the following clients is most likely ready to be dismissed from an inpatient care setting to home? A 65-year-old male with urine output of 60 cubic centimeters in the past 4 hours. B. A 2-month-old female with a temperature of 100.6 rectally. C. A 38-year-old female who transitioned from 4-TPN to full liquids 6 hours ago. D. A 4-year-old male with an oxygen saturation of 96% on room air. Correct answer: D. A 4-year-old male with an oxygen saturation of 96% on room air. Clients must meet a certain amount of set criteria before they will be discharged from a healthcare facility. Although guidelines may vary between locations, most healthcare facilities expect clients to have adequate oxygenation, nutrition, and elimination, and be free from fever, vomiting, and significant pain. 16. The nurse is performing discharge teaching for Mrs. S after cardiac angioplasty. Her husband is present for the teaching. While explaining the prescription for antiplatelet medication to use at home, Mrs. S's husband states, "I don't think I can afford to refill that medication." What is the most appropriate response of the nurse? A. Don't worry, your insurance will cover it. B. I'll ask the physician if he can prescribe a medication that is more affordable. C. You should apply for Medicare to see if they can help you. D. This medication is essential for her care and should be given priority over all others that she is taking. Correct answer: B. I'll ask the physician if he can prescribe a medication that is more affordable. In some situations, clients are sent home with prescriptions for important medications that they cannot afford. If a client mentions this to the nurse before discharge, she may be able to ask the provider for a prescription that has the same action but is more affordable to the client, such as through generic formulations or a different manufacturer. 17. The discharge planning team is discussing plans for the dismissal of a 16-year-old admitted for complications associated with asthma. The client's mother has not participated in any of the discharge planning process, but has stated that she wants to be involved. Which of the following reasons might prohibit this mother from participating in discharge planning? A. The client is an emancipated minor. B. The mother has to work and is unavailable. C. The client has a job and a driver's license. D. The mother does not speak English. Correct answer: the client is an emancipated minor. Clients who are under the age of 18 usually need parent involvement in their care and planning after they will be dismissed from a facility. There are times when it is inappropriate or impossible for a parent to be present during the discharge planning process. If a client is under age 18 but is an emancipated minor, he may specify that he does not want his parents present at discharge planning meetings. 18. Which of the following is an example of the intervention phase of the individualized nursing care plan for a client who receives a colostomy after a bowel resection? A. Taking a health history and performing a physical exam prior to the procedure. B. Instructing the client about how to care for his colostomy stoma. C. Developing goals that state the client will ambulate 3 times a day. D. Determining that the client may need more support at home after dismissal. Correct answer: B. Instructing the client about how to care for his colostomy. The intervention stage of the individualized nursing care plan is the point of care in which the nurse provides care, treatments, or education to help the client meet the devised outcomes. Instructing the client about how to care for his colostomy supports the process of helping the client to meet the outcomes designed for this case, to care for his colostomy after a bowel resection. 19. Which of the following is an example of a living will? A. A client's son has been appointed to make his healthcare decisions if he becomes incapacitated. B. A client has designated which of his children will receive his home and property before he dies. C. A client has instructions that he does not want to be resuscitated through chest compressions if his heart stops beating. D. A client designates what type of burial or cremation services he would want after his death. Correct answer: C. A client has instructions that he does not want to be resuscitated through chest compressions if his heart stops beating. A living will is a type of advance directive that a client develops to stipulate his preferences for healthcare in the event that he is unable to do so. A living will involves instructions about various situations that may occur and the client's preferences for treatment in each case, which may involve using or discontinuing life-saving measures. 20. What is involved with obtaining informed consent? A. An explanation of the reasons for the procedure. B. A signature on a form that states the client agrees to the procedure. C. A statement affirming liability if complications arise during the procedure. D. Both A and C. Correct answer: A. An explanation of the reasons for the procedure. Informed consent is the process of explaining the reasons for the procedure, the risks, benefits, and alternatives. Although the nurse may have a client sign a consent form indicating agreement, actual informed consent occurs when a physician has a discussion about the procedure with the client to educate him about the process. 21. Which of the following questions must the nurse ask when formulating a nursing diagnosis? A. What diagnosis did the physician make for this client? B. What is the issue that I can solve for this client? C. What physician orders will resolve this issue? D. What underlying disease does this client have? Correct answer: B. What is the issue that I can solve for this client? When formulating a nursing diagnosis for a client, the nurse must remember to create a diagnosis based on the client's problems that she can meet through interventions. Nursing diagnoses differ from medical diagnoses in that the physician or medical provider diagnoses a client upon admission, but nursing interventions and related outcomes are based on nursing care of the client. 22. Which of the following is a disadvantage of taking medication through an oral route? A. The drug may be absorbed too rapidly. B. The drug may have a bad taste. C. The drug is more expensive to use. D. Both A and B. Correct answer: B. The drug may have a bad taste. Medications that are administered orally may have an unpleasant taste, making them difficult to take or swallow for some clients. While oral medications are often convenient and cost-effective, they may not be used for clients who cannot swallow, those who are unconscious, or those with nausea or vomiting. 23. 1 tablespoon of medication is equal to how many milliliters of fluid? A. 5 milliliters, B. 15 milliliters, C. 30 milliliters, D. 60 milliliters. Correct answer: B. 15 milliliters. 1 tablespoon of fluid is equal to 15 milliliters. Some nurses may assist clients with measuring medications while in the home environment. There are also some over-the-counter products that list servings in tablespoons, and the nurse should know how to convert these household systems into metric systems. 24. Which of the following must the nurse consider before administering medications through a nasogastric tube? A. The nurse must determine whether a tablet can be crushed. B. The nurse must use 5 cubic centimeters of cold water to instill the medication. C. The nurse must aspirate from the tube after giving the medication. D. The nurse must immediately reconnect low-intermittent suction after the medication. Correct answer: A. The nurse must determine whether a tablet can be crushed. When giving medications through a nasogastric tube, the size of the tube limits the type of medications that can be instilled. If a tablet is ordered for a client, the nurse must check to ensure that the tablet can be crushed and then mixed with warm water. Enteric-coated medications and those that are extended release may not be crushed to use through a nasogastric tube. 25. What gauge of needle is most appropriate when giving an adult a subcutaneous injection? 16 gauge. B. 18 gauge. C. 24 gauge. D. 30 gauge. Correct answer, C. 24 gauge. When administering a subcutaneous injection to an adult, the nurse should use a fine gauge needle that is large enough to provide the medication and reach the subcutaneous fat. However, because the needle will only reach the fat and does not need to inject through muscle, a large bore needle is also not appropriate. An appropriate size for an adult client is between number 24 and number 26 gauge of needle. 26. Which is the most appropriate muscle site for an intramuscular injection for a 9-month-old child? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Vastus lateralis. Correct answer, D. Vastus lateralis. The vastus lateralis is the site of choice for administering intramuscular medications to babies and young children. This muscle is developed enough even in young children that an injection in this location is ideal. The vastus lateralis muscle is located on the anterior and lateral portion of the thigh. 27. A nurse is caring for a client who is breastfeeding her baby. Which of the following medications can the nurse administer to this client? A. Aspirin. B. Lipitor. C. Prednisone. D. Amiodarone. Correct answer, C. Prednisone. Some drugs are not safe for use during breastfeeding, as they may enter the mother's breast milk and transfer to the baby, causing unsafe exposure. There are also some drugs that are not recommended when breastfeeding because they decrease a mother's milk supply. A nurse should read the contraindications associated with any drug before administering it to a mother who is breastfeeding. Some drugs, such as corticosteroids, have been shown to be safe while breastfeeding. 28. A nurse is administering a blood transfusion when the client begins to complain of a headache and difficulty breathing. His blood pressure is 170/110 mmHg. What is the next action of the nurse? A. Administer a sedative and analgesic as directed. B. Assist the client to sit upright and slow the transfusion. C. Check the client's urinary output. D. Assist the client to lie supine in the Trendelenburg position. Correct answer, B. Assist the client to sit upright and slow the transfusion. When administering blood or blood products and the client develops symptoms of fluid overload, the blood may be given faster than the client can tolerate. Signs or symptoms of fluid overload include headache, high blood pressure, cough, dyspnea, or arousal on auscultation. The nurse should assist the client to sit up to facilitate easier work of breathing and slow the transfusion. 29. A nurse is caring for a client who has a triple lumen, peripherally inserted central catheter, PICC, in the right arm. Which of the following is a consideration when working with this type of central line? A. The client should be restricted to showers only, no baths. B. The nurse should flush one of the ports with saline solution every 8 hours. C. The nurse should avoid taking a blood pressure in the right arm. D. The client should avoid exercise until the PICC has been removed. Correct answer, C. The nurse should avoid taking a blood pressure in the right arm. When caring for a client who has a peripherally inserted central catheter, PICC, the nurse must refrain from taking a blood pressure in the affected arm. If necessary, the nurse may need to post signs in the client's room for other personnel to avoid procedures in the affected arm. 30. A nurse is caring for a client who has low blood pressure. The physician has ordered dopamine 2 micrograms per kilogram per minute on a continuous infusion. The nurse notes that the client weighs 186 pounds. What is the appropriate rate for this infusion? A. 168 micrograms per minute, B. 372 micrograms per minute, C. 168 milligrams per minute, D. 372 milligrams per minute. Correct answer: 168 micrograms per minute. When administering medications that require dosage calculation based on kilograms, the nurse may need to convert the client's weight in pounds. In this example, the client's weight is 186 pounds, which is approximately 84 kilograms. This weight, multiplied by 2 micrograms mcg of dopamine, is equal to 168 micrograms administered per minute. 31. A nurse needs to administer 15 units of regular insulin and 20 units of NPH subcutaneously to a client with diabetes. In what order does the nurse draw these medications? A. Draw 20 units of NPH, then 15 units of regular, in the same syringe. B. Draw 15 units of regular, then 20 units of NPH, in the same syringe. C. Draw 15 units of regular, then 20 units of NPH, in different syringes. D. Draw 5 units of regular, then 20 units of NPH, then 10 more units of regular, in different syringes. Correct answer: B. Draw 15 units of regular, then 20 units of NPH, in the same syringe. When administering 2 different types of insulin subcutaneously, the nurse may draw both NPH and regular insulin in the same vial as long as they are drawn in the correct order. The nurse should draw regular insulin first, followed by NPH, because NPH contains protein that should not contaminate the regular insulin vial. 32. When preparing to give a client a narcotic analgesic, which of the following information should the nurse provide as part of education? A. Take the medication on an empty stomach. B. Lie down for 1 hour after taking the medication. C. The medication may cause constipation. D. The medication may cause heartburn. Correct answer: C. The medication may cause constipation. Narcotic analgesics may cause constipation in some clients. Before administration, the nurse should assess the client's bowel sounds and review his bowel habits. The nurse should provide information about how to prevent constipation for the client and to make him aware that this is a common side effect. 33. A client is admitted to a nursing unit with a remittent fever. Which statement best describes this pattern of fever? A. A persistent fever that has lasted over 24 hours. B. A fever that lasts 2 days followed by normal temperature for 2 days, followed by fever again. C. A fever that lasts 2 days followed by normal temperature for 12 hours, followed by fever again. D. A fever that spikes and then lowers without returning to normal. Correct answer: D. A fever that spikes and then lowers without returning to normal. A remittent fever occurs when a client has a high temperature that rises and falls. The temperature may be very high or may fall to a low-grade fever, but remittent fever does not return to normal temperature during fluctuations. 34. Which of the following components is associated with hypertonic dehydration? A. Plasma sodium levels between 130 and 150 milliequivalent/L. B. Fluid moves from extracellular space to intracellular space. C. Water loss is greater than electrolyte loss. D. Physical signs and symptoms are grossly apparent. Correct answer: C. Water loss is greater than electrolyte loss. A person with hypertonic dehydration will lose more water than electrolytes, resulting in high concentrations of electrolytes in the body. Hypertonic dehydration involves plasma sodium levels above 150 milliequivalent/L as fluid in the body moves from the extracellular space to the intracellular space. 35. Your patient has been diagnosed with herpes simplex virus 2. Which of the following would not be included in your teaching of this patient? A. If you have symptoms, you should avoid sexual contact with other individuals. B. With treatment, this condition can be cured. C. This disease is highly contagious. D. You may experience tingling in the skin before an active outbreak occurs. Correct answer, B. With treatment, this condition can be cured. Treatment for the herpes simplex virus, HSV, is symptomatic and palliative rather than curative. This disease is extremely contagious and sexual contact should be avoided during active breakouts. Many patients do experience a tingling prodrome prior to an active outbreak of the disease. 36. Sinusitis is caused by A. Bacteria. B. Fungus. C. Virus. D. Any of the above. Correct answer, D. Any of the above. Although typically caused by a bacterial infection that results from an upper respiratory tract infection, chronic sinusitis can also be caused by a virus or fungus. 37. A local sign of infection is which of the following? A. Swelling. B. Rapid pulse. C. Fever. D. High white blood count. Correct answer, A. Swelling. The signs and symptoms of infection can be local and systemic, or body-wide and more diffuse. Some of the local signs of infection include swelling, heat, pain, and redness near the area. 38. A systemic sign of infection is underscore. A. Swelling. B. Redness. C. Heat. D. A lack of appetite. Correct answer, D. A lack of appetite. The signs and symptoms of infection can be local and systemic, or body-wide and more diffuse. Some of the systemic signs of infection include a loss of appetite, rapid pulse, fever, and a high white blood count. 39. A complication of osteoporosis is underscore. A. Rheumatoid arthritis. B. Gouty arthritis. C. Dorsal flexion. D. Joint deformity. Correct answer, D. Joint deformity. Joint deformity is a complication of osteoporosis. Gout and rheumatoid arthritis are other types of arthritis. Dorsal flexion is not a complication of osteoporosis. It is part of the range of motion for the foot. 40. A nurse finds one of her clients unresponsive in his room. He is not breathing and does not have a pulse. After calling for help, what is the next action of the nurse? A. Administer 2 ventilations. B. Perform a head tilt, chin lift to open the airway. C. Begin chest compressions. D. Perform a jaw thrust to open the airway. Correct answer, C. Begin chest compressions. After finding a client unresponsive who is not breathing and who does not have a pulse, the nurse should call for help and immediately begin chest compressions. Chest compressions should be at a rate of at least 100 per minute, at a depth of at least 2 inches. 41. A nurse is caring for a client with severe mitral regurgitation and decreased cardiac output. The nurse assesses the client for mental status changes. What is the rationale for this intervention? A. Decreased cardiac output can cause hypoxia to the brain. B. Mental status changes may be a side effect of the client's medication. C. Mitral regurgitation is a complication associated with some neurological disorders. D. The client may be confused about his diagnosis. Correct answer, A. Decreased cardiac output can cause hypoxia to the brain. When assessing a client who has decreased cardiac output due to ineffective cardiac activity, the nurse should assess for mental changes. Diminished cardiac output could cause hypoxia of vital organs, including the brain, which can lead to mental confusion, restlessness, or lethargy. 42. Which of the following interventions must the nurse implement while a client is having a grand mal seizure? A. Open the jaw and place a bite block between the teeth. B. Try to place the client on his side. C. Restrain the client to prevent injury. D. Place pillows around the client. Correct answer, B. Try to place the client on his side. A grand mal seizure may place the client at risk of injury due to severe, involuntary muscle spasms and contractions. The nurse should avoid restraining the client or inserting objects into his mouth, as these actions may produce further injury. Instead, the nurse should try to position the client on his side to facilitate drainage of oral secretions and to assist with keeping the airway open. 43. Which of the following reasons is the most likely cause of constipation in a client? A. Postponing bowel movement when the urge to defecate occurs. B. Intestinal infection. C. Antibiotic use. D. Food allergies. Correct answer: postponing bowel movement when the urge to defecate occurs. Clients who postpone bowel movements by either ignoring the urge to defecate or not evacuating for some reason, like not being near a bathroom, may be at higher risk of developing constipation. This causes a decrease in the frequency of bowel movements, slowed motility of the intestinal tract, and increased absorption of fecal water, contributing to hard, dry stools that are difficult to pass. 44. A nurse is assisting a client with range of motion exercises. She moves his leg in a pattern of circumduction. Which movement is this nurse performing? A. Bending the leg at the knee. B. Turning the foot inward and outward. C. Moving the leg in a circle. D. Moving the leg forward and up. Correct answer: C. Moving the leg in a circle. Circumduction is the process of moving a limb in a circle. In this case, circumduction of the leg is a range of motion exercise where the nurse moves the leg in a circle, working the muscles of the gluteus maximus and gluteus medius. 45. A nurse is assisting a client to lie in the Sims position. In what position does the nurse arrange the client? A. The client lies on his side with the upper leg flexed. B. The client lies on his back with his head lower than his feet. C. The client lies on his abdomen with a pillow supporting his head. D. The client is sitting up at a 90-degree angle. Correct answer: the client lies on his side with the upper leg flexed. The Sims position is a side-lying position for clients that may be used for examinations or to lie comfortably. The Sims position involves aligning the client to lie on his side with his abdomen slightly downward. The upper leg is flexed, while the lower arm under the client is positioned behind his body. A pillow may be used to support the leg. 46. A nurse is instructing a client about how to use his crutches. Which of the following information should the nurse include in her teaching? A. Place the majority of body weight on the axilla. B. Dry crutch tips with a paper towel if they become wet. C. Use the crutches for support to lift both feet simultaneously when ascending stairs. D. Both A and B. Correct answer: B. Dry crutch tips with a paper towel if they become wet. When instructing a client as to how to use crutches for ambulation, the nurse should teach the client the importance of keeping the crutch tips dry. If the tips become wet, the client could slip while supporting his weight on the crutches. The nurse can teach the client to inspect the crutch tips for moisture and dry them with a paper towel if they become wet. 47. Which of the following is a disadvantage of using a dry heat application? A. Dry heat is more likely to cause burns than moist heat. B. Dry heat penetrates deeply into the tissues. C. Dry heat causes the skin to dry out more quickly. D. Dry heat can quickly cause skin breakdown. Correct answer: C. Dry heat causes the skin to dry out more quickly. When applying a heat application for therapy, the nurse often has a choice between moist or dry applications. Dry applications may be less likely to cause burns and are less likely to contribute to skin breakdown. However, dry heat applications do not penetrate deeply into the tissues and may cause the skin to dry out more quickly. 48. A nurse is assigned to care for a deaf client. During her lunch hour, she visits the hospital library and reads more about deaf culture in order to better provide appropriate care for her client. This action is an example of cultural knowledge. B. Cultural noise. C. Cultural diversity. D. Cultural divide. Correct answer: cultural knowledge. Cultural knowledge involves looking for information and educating oneself about different cultural groups. The nurse who cares for a client with a language that differs from her own and who strives to learn more about the deaf culture is exhibiting cultural knowledge. Practicing cultural knowledge works to reduce cultural barriers that can impede communication between nurses and clients. 49. Which of the following clients have a barrier to accessing healthcare? A. A 36-year-old client who must use a wheelchair for mobility. B. A 44-year-old client who is visiting the United States on a visa from India. C. An 81-year-old client who is unable to drive. D. All of the above. Correct answer: D. All of the above. Barriers to accessing healthcare may take many forms, whether it is physical, financial, or cultural. Clients who have physical limitations may face barriers with movement or travel. Those with language barriers may have difficulties with communication if an interpreter is not present or available, and clients who are unable to access their services, such as those who are homebound, face barriers to receiving healthcare. 50. A client in a long-term care facility tells the nurse, "My daughter never visits me." The nurse responds by telling the client that when her own mother was in a long-term care facility, she found it difficult to visit. This is an example of which communication technique? A. Empathy. B. Self-disclosure. C. Disapproval. D. False reassurance. Correct answer: B. Self-disclosure. Self-disclosure is a type of therapeutic communication technique that nurses may use with clients to encourage them to share more information. Self-disclosure may help a client to feel more comfortable with sharing, believing that the nurse personally understands. Self-disclosure may also be a negative technique if the nurse shares too much information or the client becomes uncomfortable. 51. A nurse caring for a pediatric client shows little concern when the parents attempt to speak with her about their daughter's illness. When approached by the nurse manager about her behavior, the nurse responds by saying, "I don't want to get involved. It doesn't matter what I do anyway, my work does not make much of a difference." This nurse is exhibiting which of the following characteristics? A. Objectivity. B. Depersonalization. C. Procrastination. D. Disruption. Correct answer: B. Depersonalization. A nurse who sets herself apart from her clients to avoid becoming involved is using depersonalization. This behavior may occur among nurses suffering from burnout as a result of stress. Depersonalization is often the result of poor morale or feelings of moral distress and may act as a defense mechanism to avoid feeling greater burdens when under stress or emotional exhaustion. 52. A nurse is asked by a physician to speak to a colleague about her unprofessional behavior in front of a client. The nurse does not want to create conflict with her colleague, so she does not confront her and stays away from the physician when he comes in to work the next day. Which type of conflict resolution is this nurse exhibiting? A. Accommodation. B. Competition. C. Avoidance. D. Negotiation. Correct answer: C. Avoidance. Avoidance is a form of conflict resolution that seeks to ignore the problem in hopes that it might go away on its own. Avoidance is a passive form of resolution in that it usually does not accomplish the intended action. While keeping distance may allow others involved to obtain more insight about the situation, avoidance often does not result in resolution of issues or problems. 53. You have accompanied the physician into the family waiting room to tell a young husband that his wife has not survived the car accident she was in. The husband is crying and distraught. What is the most appropriate approach to supporting this family member? A. Ask if he would like to donate his wife's organs. B. Sit quietly with him. C. Ask about funeral arrangements. D. Consult social services. Correct answer: B. Sit quietly with him. The most caring and supportive approach in a time of extreme distress is usually to sit quietly with the distressed party until he's had the opportunity to absorb the news and gather himself. Providing a supportive presence is often the most valuable tool a nurse can use when circumstances provide overwhelming emotional pain to those they are caring for. 54. Rachel is a 48-year-old mother of 3 who has been admitted after a drug overdose in a failed suicide attempt. When she regains consciousness, she states that she is ashamed and embarrassed that she tried to take her own life. What is the most therapeutic response to Rachel's statement? A. It's a blessing your children weren't left without a mother. B. What were you thinking? C. We're here to help patients who value life. D. I know life can be difficult. We're here to help you. Correct answer, D. I know life can be difficult. We're here to help you. Offering non-judgmental support and hope is the most therapeutic response which will help the patient to maintain her self-esteem. The nurse's role is to treat all patients with respect and dignity, regardless of the situation, and offer supportive measures which will benefit healing in all realms. 55. A male nurse that is working on a labor and delivery unit has been pulled from providing care for a patient who is of the Islamic faith. The patient asks the charge nurse to remove her from the nurse's assignment. The charge nurse understands, fulfills her request, and notifies the nurse. Which explanation by the charge nurse is correct? A. We must honor any wishes made by the patient. B. A male nurse should not be in the delivery room when a woman is giving birth. C. Islamic women must only receive care by female healthcare providers during birth. D. Only doctors and midwives are permitted in the delivery unit. Correct answer, C. Islamic women must only receive care by female healthcare providers during birth. Islamic women must be cared for by female healthcare providers during childbirth. There are also strict guidelines in their religion that require them to cover their head/body when a non-immediate family member is present in the room. 56. A 42-year-old female was admitted to the ICU following complications after a motor vehicle accident. The patient suffered a traumatic brain injury, TBI, and is now intubated and non-responsive. The patient's daughter is 17 years old and is at the bedside alone. She is sobbing, saying, "She is all I have. If she dies, I want to die too." What question by the nurse elicits the most information in evaluating the daughter's support system? A. Do you need to talk to a social worker? B. Do any family members live close to you? C. How old are you? D. What school do you go to? Correct answer, B. Do any family members live close to you? It is important to determine the daughter's support system in this scenario by asking what other family members live close that could help her or that she could temporarily live with during this time. It becomes the nurse's responsibility to gather information. It then would be appropriate to consult a social worker. 57. Manual hematocrits are done, A. To monitor anemia. B. By using a microcredit tube. C. To measure the percentage of plasma to cells. D. All of the above. Correct answer, D. All of the above. Manual hematocrits are a CLIA waived method for monitoring anemia. Blood is collected in a microcredit tube, centrifuged, and the percentage of plasma to cells is measured. 58. A patient has come to the office for a blood draw. The patient starts to sweat and is very anxious. Which of the following would be the best way to proceed? A. Do not perform the procedure. Notify the physician of the reason why. B. Perform the procedure but pay close attention for signs of potential syncope. C. Allow the patient to reschedule for a time where he isn't as anxious. D. Have the physician draw the blood. Correct answer, B. Perform the procedure but pay close attention for signs of potential syncope. Sweating is a common occurrence with anxiety. Provided the patient is not showing signs of fainting, the phlebotomy procedure can be performed. Notify the physician if the patient does faint. 59. Which of the following tests would most likely be performed on a patient that is being monitored for coagulation therapy? A. Point/INR. B. CBC. C. HCT. D. WBC. Correct answer: PT/INR. Prothrombin times, PT/INR, are frequently used to monitor Coumadin, warfarin, therapy. This medication is an anticoagulant which slows the blood's ability to clot. 60. Which of the following is most true about the ESR test? A. The results are diagnostic for certain conditions. B. Abnormal results are indicative of a potentially fatal illness. C. Abnormal results should be followed with additional testing. D. Results are reported in millimeters per minute. Correct answer: C. Abnormal results should be followed with additional testing. The erythrocyte sedimentation rate is a screening test for inflammation. The test is not used to diagnose any condition, and abnormal results should be investigated further. Results are reported in millimeters per hour. 61. Which of the following is considered an abnormal lab result? A. WBC 10,000/mm cubed. B. HCT 50%. C. ESR 22 mm per hour. D. All of the above are normal. Correct answer: C. ESR 22 mm per hour. Normal values for ESR are 0 to 10 mm/HR for men and 0 to 20 mm/HR for women. 62. The mordant in the gram stain procedure is A. The crystal violet. B. The methyl alcohol. C. Iodine. D. Safranine. Correct answer: C. Iodine. The gram stain procedure uses 4 chemicals: crystal violet, primary stain, grams iodine, mordant, methyl alcohol, decolorizer, and safranine, counterstain. 63. A urine pregnancy test may be negative even if a blood pregnancy test is positive. B. Is positive only during the first trimester of pregnancy. C. Will be negative if the amount of LH isn't enough to meet or exceed the sensitivity of the testing device. D. All of the above. Correct answer: may be negative even if a blood pregnancy test is positive. Urine pregnancy tests detect HCG in a pregnant woman's urine. Blood levels of HCG are usually higher and register earlier than HCG levels in the urine. 64. Mr. K is admitted to the orthopedic unit one morning in preparation for a total knee replacement to start in 2 hours. Which of the following is a priority topic to instruct this client on admission? A. The approximate length of the surgery. B. The type of anticoagulants that will be prescribed. C. The time of the next meal of solid food. D. The length of time until the client can return to work. Correct answer: the approximate length of the surgery. While follow-up care and discharge instructions are important to review throughout hospitalization, pre-surgical teaching should focus on what to expect for the upcoming procedure. The client may be more focused on the surgery and may want to know facts about the procedure to better prepare him or to relieve anxiety. Information about what to expect after the procedure can be presented well before the procedure and then reviewed again afterward. 65. A. Nurse in the emergency room enters a client's care area to start in 4. She finds a man sitting on the table, hunched over, and attempting to take deep breaths. He states, "My chest hurts so much." His wife is sitting on a chair in the corner, crying. Which of the following is the first action of the nurse? A. Bring the 4 kit and quickly start in 4. B. Assess his breathing and provide oxygen, if necessary. C. Administer medication to control chest pain. D. Talk with his wife and find out why she is crying. Correct answer: B. Assess his breathing and provide oxygen, if necessary. In the above scenario, the first action of the nurse is to assess the client's airway and breathing and administer oxygen if necessary. The client may be suffering from chest pain that causes breathing difficulties, but air exchange is essential to address before treating other needs. 66. Which of the following screening tools have been found to have a high diagnostic accuracy for screening for intimate partner violence? A. Hurt, insult, threaten and scream, hits. B. Humiliation, afraid, rape, and kick, hark. C. Slapped, threatened and thrown, stat. D. All the above. Correct answer, D. All the above. According to the National Preventive Services Task Force, these 3 screening tools have been shown to have high diagnostic capability to show current or recent intimate partner violence. The partner violence screen may have value in predicting future intimate partner violence. 67. A family member is complaining that the lights are too dim in the middle of the night when she comes in to visit her husband. What is the most objective response? A. Patients sleep better with the lights dimmed. B. The night shift nurses prefer to work with less light. C. It's time for him to sleep, and you should, too. D. There's a reason we do that. Let me share a research study with you. Correct answer, D. There's a reason we do that. Let me share a research study with you. Providing the results of a research study with the patient's wife may help her to understand that the unit is operating from the principle of evidence-based practice. This knowledge may help put her mind at ease, and help to assure her that her husband is getting the most appropriate care possible. 68. What is a key principle of patient teaching that must take place to ensure patient safety? A. Family members should be present. B. Teaching must be documented. C. Understanding must be confirmed. D. Teaching should be provided by multiple staff members. Correct answer, C. Understanding must be confirmed. A key principle of patient teaching that ensures patient safety is confirmation of understanding. This can be done by asking the patient to repeat the understanding of the information that has been given, and if a procedure, by asking for a return demonstration. Patient understanding should be appropriately documented as part of the teaching record. 69. A nurse is assessing a client's pulse oximetry on the surgical unit. As part of routine interventions, the nurse turns off the exam light over the client's bed. Which of the following best describes the rationale for this intervention? A. External light sources may cause falsely high oximetry values. B. A bright light in the client's face may cause a low pulse oximetry. C. External light sources may cause falsely low oximetry values. D. The client needs a dark and quiet room to recover and maintain proper oxygenation. Correct answer, A. External light sources may cause falsely high oximetry values. When assessing a client's pulse oximetry values, the nurse should turn off any extra environmental lights that are unnecessary, including exam lights or overbed lights. External light sources may cause falsely high oximetry values when the extra light binds to the sensor of the oximeter. 70. Which of the following conditions increases a client's risk of aspiration of stomach contents? A. A client has a scaphoid abdomen. B. A client is in restraints. C. A client is lying prone. D. Both B and C. Correct answer, B. A client is in restraints. Some clients may be at higher risk of aspiration of gastric stomach contents into the airways, placing them at risk of pneumonia. A client who is in restraints may be unable to use his hands to help himself turn or move if he begins to vomit. Other situations that increase risk of aspiration include a client with a full and rounded abdomen and a client that is lying flat and supine. 71. Hepatitis C virus, HCV, can be spread through hugging, sneezing, coughing, sharing eating utensils and other forms of casual contact. A. True. B. False. Correct answer, B. False. False. HCV is spread by direct contact with human blood through blood transfusions, improperly sterilized needles and syringes, needle sharing, or occasionally through sexual contact. 72. The primary route of transmission of RSA is via shared needles. B. Hands of healthcare workers. C. Items in the healthcare environment. D. Blood transfusions. Correct answer, B. Hands of healthcare workers. It is well documented that the primary route of transmission of RSA is via unwashed hands of healthcare workers who carry the Staph aureus organism from one patient to another. Case Study 2. A 14-year-old client is brought to the emergency department by her parents. The parents report the client has no medical history but has been experiencing weight loss over the past 2 weeks, nausea, and overall reports feeling unwell. Exhibit 1, Nursing Assessment, 1924. Neurological Assessment, Alert and Oriented, PERLA, GCS 15, Generalized Weakness bilateral upper and lower extremities, full sensation, denies numbness/tingling. Cardiac, tachycardia, S1 S2 auscultated, no edema noted. Integumentary, skin is pale, warm, and dry, tenting skin turgor, peripheral pulses +2, capillary refill less than 2 seconds, dry mucous membranes. Respiratory, tachypnea noted, deep respirations, clear lung sounds bilaterally, no cough noted. Gastrointestinal, nausea and vomiting present, generalized abdominal pain, denies diarrhea. Genitourinary, reports polyuria. 73. Exhibit 3, Hourly Glucose, 2200. 2014, 524 mg per deciliter, 2100, 468 mg per deciliter, 2200, 396 mg per deciliter. At 2032, the nurse begins administering a prescribed continuous for insulin infusion at 0.1 unit/kg/hr and checks the client's glucose hourly. Which is the appropriate action by the nurse after reviewing the client's trending glucose during the infusion? A. Discontinue the infusion immediately. B. Call the healthcare provider for further orders. C. Continue the administration as prescribed. D. Perform a recheck of the client /S glucose. Correct answer, C. Continue the administration as prescribed. The nurse continues the infusion as prescribed. For insulin administration for the client experiencing DKA is administered to lower serum glucose by 50 to 75 mg per deciliter per hour. Therefore, after the nurse reviews the trending glucose, it is noted the client's glucose is being lowered and managed appropriately. Within the first hour, the client's glucose drops by 56 mg per deciliter and then drops again by 72 mg per deciliter. 74. During the nurse's rounding to check the glucose at 2300, the client reports, "My head really hurts." Which is the most appropriate response by the nurse? A. That is common, and I will dim the lights in your room. B. Can you tell me your name, where you are, and the year? C. Do you want me to see if you have something prescribed for pain? D. I am going to put the head of the bed down flat. Correct answer, B. Can you tell me your name, where you are, and the year? The appropriate response by the nurse is to evaluate the client's neurological status. Lowering the client's glucose and serum osmolarity can result in cerebral edema, a greater risk for the pediatric population. Therefore, the client's neurological status needs to be closely monitored, and the nurse needs to include frequent neurological assessments while monitoring the client in DKA. A headache or change in mental status can indicate this complication. Although it is rare, the mortality rate is high if it occurs. The nurse needs to collect more information from the client and notify the healthcare provider of the client's reported headache and additional findings. Answer D is incorrect. If the client is experiencing cerebral edema, intracranial pressure will be increasing. Laying the client flat will only increase intracranial pressure. 75. Exhibit 4 Nursing Note, 2350. The client had reported a headache, and the healthcare provider was immediately notified. The client remained alert and oriented and is acting appropriately for the client's age. Acetaminophen was administered for the client's headache, and the client is reporting relief from symptoms. The client is currently resting comfortably, and vital signs are stable. The client is maintained on continuous cardiac monitoring and maintained on insulin infusion per the healthcare provider's orders. This RN will continue to monitor the client's neurological status closely. The client's DKA has resolved after 4 insulin and fluid replacement. The nurse educates the client and family regarding type 1 diabetes. Which of the following statements does the nurse include in the education? A. Diet and exercise might make it possible to stop using insulin. B. If not eating during illness, skip the usual insulin dose. C. Checking frequent blood sugars is especially important while sick. D. Exercise after insulin administration when insulin levels are peaking. Correct answer, C. Checking frequent blood sugars is especially important while sick. The nurse is correct when educating the client and family to check frequent blood sugars during illness. Illness makes the client diagnosed with diabetes more susceptible to DKA because they are not able to drink or eat as much, which makes regulating the client's glucose more difficult. Therefore, the nurse includes in the client's and family's education the importance of careful glucose monitoring during illness. Answer A is incorrect. In type 1 diabetes, the body destroys the beta cells in the pancreas, which results in the body no longer being able to produce insulin or the body produces very little. Therefore, the client must take insulin for the rest of their life. Lifestyle choices, such as diet and exercise, have no role in the development of type 1 diabetes. Answer D is incorrect. The client should avoid exercise during the peak of insulin levels. Exercising during peaking insulin levels increases the risk of hypoglycemia. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.